I'm really thrilled to have all of you here today. It's just the first ever time we have done something like this in Sacramento, so I think it's a really very exciting event. This event is born out of the creativity and the promise of making public data available for public good. And I think that only good things can come from that. I know that there are some folks who would think that, well, there might be some bad things that can come from that, but we have to be sure that we don't let that happen. There are a growing number of examples of this phenomenon across the planet, not just in the United States, but across the planet, where thoughtful governments have been able to augment their ability to serve their publics. And to do that by helping the public serve itself in a cost-neutral or even a cost-savings way. So those are important things to remember as we think about what we're trying to do here today and how we might be able to pay for that. Because we're certainly not expecting that this would generate a new program with a new budgetary need. We're expecting that these kinds of things can pay for themselves in some kind of savings. Or at least be cost neutral. So I'm hoping today will energize you to the possibilities and stimulate your thinking about next steps that you will take and that your organization will take. And if you're anything like me, you'll begin to see a whole new realm of possibilities to benefit citizens and stimulate economic activity and reduce costs of government. And there's no pressure, but yesterday I thought of a little app all by myself as we were thinking about, the agenda, and it's around smartphones, and so, no pressure. I'll just throw that out there. You guys can be thinking about it too. So the conversations that you'll have over the next couple of days are important beginnings. And I hope you'll take the opportunity to dig in and consider and really immerse yourself in the conversations that are going on, offer thoughtful feedback and consideration of the topics. So we're fortunate to have a lot of sponsors of this event over the next 2 days. And right now, it's my distinct pleasure to introduce the major benefactor representative, Andy Krakoff, Senior Program Officer for the California Healthcare Foundation.
Hi, everyone. I'm just going to go forward a few slides. I'm guessing you may not need these now. Or maybe you'll be using them later. Okay, so I'm just kind of curious. We're going to go back a few hundred years, if you don't mind. Does anybody know what this may be? And I'm not expecting it, but if I get a hand, that's great. But anyone have any ideas? Okay, so the specific answer is that this is a bar graph, of course, of imports and exports from Scotland and to Scotland from 1786. It's from a political atlas. But the subject matter, of course, may not really matter too much to us unless we all happen to be, students of Scottish trade history. But why I'm pointing this out to you is this is actually credited with being the first ever bar graph, first published bar graph by William Playfair. He created it for his atlas. And he actually didn't stop there. He also created the first trend graph with data he had. He also created the first pie graph. So he's certainly been very prolific in his career. Let's move forward just a little bit. This was 1780s. Anybody know what this is? We got a lot of people from CDPH here. I'm guessing we may have a few hands for this. Anyone know what this is? Why don't people shout it out? That's right. That's right, yeah. So for those that don't know, this is a map of Soho, London back in 1854, where, as you may know, there was a severe cholera outbreak. And from the data that John Snow collected, he was able to use this map to show that it was contaminated water, not bad air, that was causing this cholera outbreak. In many ways, he's the founder of epidemiology. This map, in many ways, it changed how we saw disease. Where you see sort of the bigger, darker lines, bar graphs they almost look like, that's where there was more incidence of cholera. And now it's hard to see, but if you see where it says Broad Street, there's a pump right there where there's sort of the biggest outbreak. And that's how, one of the ways in which he used to determine this. The larger point in showing you all this is what seems to me is that if you put useful data into the hands of smart thinkers, important innovation can happen. And this has been obviously true historically for many years, which brings us to the present. I think, from my standpoint, there are many important reasons to embark on an open data strategy. I think the intrinsic benefit, no question, of transparency in and of itself is very important. I think improving efficiencies within government is also a very important reason. But among all the reasons, one stands out to me: to enable journalists, researchers, community leaders, local policymakers, and of course entrepreneurs to catalyze some of the new and important and hopefully lasting uses of data. And an example of that, for example, would be for creating visualizations of data, putting the data out there so we can all help educate Californians around the state about what's going on. Take this forward a few hundred years. That, to me, really is what open data is about. It's absolutely about publishing data, and the important role that government plays in that. So we're talking here about publishing data, as you know, not through PDFs, but in machine-readable, easier-to-access formats. But that's actually part of the equation, in my estimation. The aim is to publish these data, I think, so that those outside of government can really harness and capitalize on the data. And we're talking here, I think, as you all know, about publishable data, de-identified, aggregated data. There are some data that we all know belong behind closed doors, and that's not what this is about. But if you put publishable data, I think, in the hands of Californians, with our unparalleled history of innovation, I think the return on this investment will be incredible. So I think today and tomorrow, you're all going to be able to help us set a course for how we can really equip communities across the state, providers across the state, with the seeds of innovation and help them really understand how they can use these data to better make decisions about their patients, about their community members, about the people they care about. Over the next couple days, we're going to talk about many elements of open data, and I'm hoping, honestly, that we can do so in a frank and sincere way. We should approach open data, with a critical eye. It's somewhat new to us here, I think, in California, or at least in state government. And there may be some concerns that you'd have, privacy, for example, or misuse. The event organizers here at Stewards of Change, they really deserve credit for creating a very participatory agenda. And so I really hope you all can take advantage of that. I want to hear you air both your dreams and the concerns that you may have. After all, a key goal of this event, it really is to get your input. Your ideas, for example, will actually be very helpful for us at the California Healthcare Foundation. We have an initiative that's called Free the Data. And the whole aim of Free the Data really is to encourage open data and open health data across the state of California. And your insights today and tomorrow, no doubt, are going to help inform our future grant-making strategies. So I really appreciate the time that you're all going to put in for this. There's a number of people I want to thank, in addition to my fellow sponsors. Stewards of Change, for all of the work that they did to help plan and put on this event. Shell Culp, too, no question, she deserves so much credit for helping to establish this conversation within the California Health and Human Services Agency. We're deeply appreciative to all of the speakers, some of whom have come cross-country for this, to help share the insights that they've learned from elsewhere. But most importantly, I actually really want to thank all of you for taking time out of your busy schedules, for giving us your insights. I think that's going to be really key here. So let me now introduce Daniel Stein, our co-conspirator in planning this event. Thank you.
Good morning, everyone. Well, am I glad I'm on the West Coast today. I hail from New York, and not a good time to be back there, as it appears. So I got the timing right on this one. We used to do conferences in January, and every time January would roll around, we'd be watching the weather like 2 weeks out, a week out, 10 days out, all that kind of thing. As the storms would roll in, we got more and more scared. So we decided just to do conferences in California from this point in time, despite the weather. We'll see if we can do a little dance for you later. So usually, in fact, when we've done some work in San Diego, every time we'd go down there, it would rain. So, there's hope. We'll see how that works there. So I'm delighted to be here. I want to also thank Andy and the California Healthcare Foundation for really providing both the leadership and the thought and some of the resources to make this event happen, and Shell for her leadership within government. within OSI to make this happen. But we also have a number of other sponsors who have been very helpful to making this event happen. And they are along here, and I hope that during the breaks and lunch and after and before, you spend some time with them. This is our mini solution center, as we call it. And we'll hear from each of them, or most of them later today, about some of the real innovative things that they're thinking about going into the future and how some of the technology can really support the work as we're going forward. But I want to call out big thanks for Esri, for really providing a lot of support for this work and a lot of encouragement, along with IBM and Software AG. And then the Health Data Consortium. So Dwayne Spradlin is here somewhere. There he is in the back there. We got encouraged last year with the advent of the National Health Data Palooza, and then the work we did last year. Got very excited about the work and his leadership and being so open and willing to share the work of the Health Data Consortium. We're really excited about that. And also public sector partners who are putting on the big data event upstairs tomorrow, and we'll talk about that a little bit. We were able to actually make that happen. And of course, I want to thank all the folks within Stewards of Change and our friends and partners who helped do this. And you will see them if you guys can stand up, and ladies could stand up so we can identify you. Up, up, up. The guys in the back there, and some folks out in the back. So we will be agitating. Their role is to help agitate and to facilitate as we go on for the next couple of days here. So I'm just going to make a couple of introductory comments just to set the stage a little bit more about what we're doing, go over the agenda, and just give you some words of thought. And we'll talk more about this later. That acronym, right? So what comes to your mind when you see HHS? It probably isn't this. So the reason I put this up here is to help us think about both the health components and also the human services components of the work that many of you do and are involved with. And there's an intimate relationship between these two real fields of work, both at the federal level, the state level, the county level, the city level. It's the interaction between health and human services that's so important for achieving the triple aim. As we look at going forward in our nation over the next number of years, we know that we need to rein in healthcare costs. We know that we need to do that smartly and with a lot of creativity. And we will, I think, only be able to do that if we consider the social and human services components of it. And we'll talk a little bit more later about the social determinants of how that may affect our healthcare services. But when we think about open data, a lot of the kinds of information we're talking about actually resides in the human services aspects of things. So, and as I said, we'll talk more about that, but where are the services, where are the resources, where are the information about what's going on in a community that both a client and a service provider can readily capture? And that's part of the exciting part about open data. It really complements in many ways providing a three-dimensional or holistic perspective of a client or a person in their community. And how can we motivate them? How can we empower them to know what services are available, what kinds of information they can gain themselves within their own communities to help them in whatever ways they're thinking about. So I just wanted to put that thought out there, and hopefully that will stick with you for a long time. So as we're having this HHS conversation, I have not yet advocated within HHS federally to change the terminology here, but I'm sure Brian will maybe help us think about that. A little bit, okay. So we want to start with the end in mind as well. As Andy and Shel both alluded to, part of the purpose of this meeting and this conference, or symposium as we call it, is to come out of it with some ideas about what's next, right? So this is the first time I think we've gotten together around this topic, and we really want to crowdsource the ideas here. We really want your thinking and your participation so that as we go forward, beyond tomorrow, we have some ideas, and these ideas are not from the top of the HHS bureaucracy down, this is what we're going to do, but it's really broad and wide across the state. And as you look at the contact sheets in your packets, you'll see that we have a really broad participation from across the state, across the county, across the federal, state agencies, and a lot of the NGOs here. So it's a really nice broad cross-section. We have established something that we're calling the Open Data Collaboration Site. It's a SharePoint site that will house all the materials from this event, We are videotaping the event. All the videos will be published on that site intact as they are. So, and that will be semi-public. You do need to register to get into the site, but it is a way for us to be able to continue the conversation. And we did that last year during the interoperability project, and it was very successful. We had a lot of people participating in that conversation, and it does allow us a way to continue the work going forward, which will be obviously really, really important as we do that. And so you'll have to just email Mike Kerr. I think you all have his email, and we'll put this up later. Anyways, just it's a site. It's got, like most SharePoint sites, there's file folders for both presentations and video. And there's actually, on the site, there's actually a number of videos now that we've culled from various places. They're pretty exciting about open data, where it's headed next. And it is a good resource, I think, for folks if you want to get into it. And importantly, if you want to share it with other people, it's not necessarily closed just to the folks in this room. It's open. You can invite anyone to participate in this if you like.